Hey guys, it's Denise again, back with a quick video, part 2 of what you'll need at home after delivery for your newborn, and tips on how to put your baby down using those 5 S's and the shush sound. So stay tuned.
So the next little basket I got for Kelsey is just a little basket to help her when she's going to be changing baby Connor. So this is a few little things that I've got for her. So one is a bulb syringe. I recommend you have more than one. This is the one that she's going to be getting from the hospital. The reason why is because you do not know when they're choking, especially when they're in their car seat. You cannot get them out of the car seat fast enough if you feel they're choking. So you need to have this one in their bed area, as well as in the car, and then in their baby bag is what I recommend, at least 3. So the trick is like, well, how do you keep this clean? And you can, it's almost impossible. So while you are bathing your baby and you're cleaning the baby cord, you can get you some rubbing alcohol. I recommend just putting a little bit of, I'm sucking this up in the cap, swishing it around with some water and leaving it upside down. A lot of people want to put it on its butt like this, but it's trapping all that in. So you can turn it upside down and put it maybe in your toothbrush dispenser or an inexpensive, plastic cup. Here we use Mardi Gras cups for everything. So I would put it upside down in a Mardi Gras cup, and that keeps it, allows it to air dry and drip everything out. Now just FYI on the bulb syringe, this is good for ears, nose, and throat. So when you are bathing your baby and accidentally they got some water in the ears, you're supposed to flip their ears over like you would a little puppy dog. This will allow, you can suction this up as well. So don't think, do never, 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 ever, never put a Q-tip in that baby's ears, okay? But with that said, I do have baby Q-tips, and they have really come a long way on Q-tips. These are actually very fine Q-tips. It says you can put them in your baby's ears. You're not going to do that until the pediatrician recommends it. What I do like these Q-tips for is to clean off the belly button. And I do have a video on that when you're changing the diapers, and it's got a little point. So what you do is take the rubbing alcohol, soak it just a little bit, and go around the belly button. Now you don't ever have to clean the belly button with these, but it will take over 2 weeks for it to come off. You can use this, or you can also use the witch hazel that I have as well. It's also a drying agent as well. So I tell moms, you be the guy. If the baby's tummy's irritated and raw, then don't use rubbing alcohol. It's going to make it worse. If it looks, good, then continue. Now, definitely, I would recommend after the bath because they're nice and wet, it's moist, and maybe every other diaper change. And if it looks good, then you can do it every diaper change. It's not necessary, but it does help that little cord to fall off, and it usually takes about 2 weeks. And that's also about how long it takes for the circumcision to heal either. And that's another part of my 2-week rule. So there's your Q-tips of that, as well as we talked about Vaseline if it's a baby boy and we're needing a circumcision. So you would take the diaper. You can do like a little Christmas tree to the point on top of the penis, which is kind of hard and it kind of falls back and forth, but it's great if you can find it in a tube. But this big old tub, take it and take the diaper and just swoosh it in there, and the whole front of the diaper is covered. This has nothing to do with keeping clean or keeping away from infection. This has to do with the diaper not sticking to the penis, because it's kind of like a Band-Aid. If you took a Band-Aid off really quick, it would make it ooze and bleed more. So this is just to prevent it from sticking to the diaper, which we don't want because that would hurt our babies. So here's a good trick for that. I also got her some Boudreaux butt paste because that's what we use here in Louisiana. We like Boudreaux. Now you should probably, as a rule with diaper rashes and ointments and things like that, if it is yellow, it usually has some form of alcohol in it, and your baby's bottom is irritated, you don't want to use rubbing alcohol because that hurts. So anything that's white and creamy, it tends to have the non-alcoholic ointments in there. So as a rule, I would recommend white ointments for that. Okay, so another little thing I just added to her is some bright water to help with his tummy, just in case he gets colicky or irritated. This is something you do not want to go try to find out until the morning if you're losing your mind. You can just put a few drops of this. And once again, this is also when the pediatrician says it's okay to start this. Now this is a little trick. Babies at a couple of weeks to almost 3 months, they will get cradle scalp and their hair's kind of flaking off. Well, you start picking that out, you're gonna go, oh my gosh, I'm picking the baby's hair out, and that's you're like, you don't wanna lose your baby's hair. So what we recommend is you can do coconut oil, just put a little bit on there, and you take the brush that we use at the hospital, and we actually brush our fingernails and clean it with it. But this is so soft. And what it'll do, it will lightly pull up the cradle scalp without hurting the baby. So you can put a little bit of this, especially if they have a little irritation. That coconut oil will actually help it keep it moist and not fall off so bad and dry up. So these, I know our hospital, we wash the baby for the first time after 12 hours. We use this to kind of clean off the hair and things like that. Just ask them if you can have it, or if they can give you one. This would be a good thing to have her at home. Okay, and then obviously a basket to put all of this in. Okay guys, so this is my next trick, is when you are time to put the baby down and you've got him or her laying down flat, you want to have some type of sound to maybe distract from the car noise outside or the TV and things like that, or a sound for them to know it's time to sleep. I have my cute little nephew is much older now, but when he was 4 or 5, he would go get his blanket and he would push his button, and it was actually Mozart singing, and every time he heard that, he knew it was to go night night. That also helps him to calm him down. That was what he used. I actually, at home, I use, because we didn't have these cute little white sound noises when I had my kids, but what, as a simple trick, is the vent hood in your kitchen makes a loud deep sound that sounds like mommy's tummy, as well as the bathroom hood too does help. So this is just a simple, inexpensive white sounds machine that I got from Conair. It has mommy's heartbeat, white noise, it has oceans, birds, things like that, to try to get an idea and figure out what your baby likes as well. On the other side, your cell phone, you probably should be able to have white sound, so if you're needing it for your car. And if you do have like a Echo or a Google Home, what are they called? Google...
Alexa?
Alexa, a Google or Alexa that can play music and things like that. You say, hey Google, or hey Alexa, play, baby white noise or white sound or a baby lullaby. So those are little things too, but this is actually one that is battery operated, so you can take it to and from as well.
Hope you guys enjoyed the video, and if you want to learn more about newborn care, I recommend these videos about the demonstration of 5 S's and the 2-week rule for your babies. And of course, if you want to learn how to change a baby boy's diaper with umbilical cord care. Until then, good luck, and you've got this.